Hello viewers, welcome to my channel Dr. Ghosh Presents. Myself Dr. Surojit Ghosh speaking to you from Kolkata, India. Today the discussion will be on Alzheimer's disease. The caption being Alzheimer's is incurable but its prevention is not impossible. This 7C conqueror, Indian Bengali, breathed his last suffering from Alzheimer's and Parkinson's. I dedicate this video in his holy memory. What is Alzheimer's? We know that our brain is made up of billions of nerve cells. These cells are interconnected and they send and receive signals among themselves continuously. In Alzheimer's disease, of late it is called simply Alzheimer's apostrophe or Alzheimer's, the connectivity among the cells is damaged severely. This is a type of incurable dementia in which memory, thought process and cognitive aspects of the brain of the patient go from bad to worse with time. A very painful and miserable type of disease this is. What actually happens in Alzheimer's? In Alzheimer's, unnecessary protein accumulates in brain and forms plaques and tangles which damages connectivity among cells. Cells die and the brain matter shrinks. Look, on the right hand side, the Alzheimer's brain is shown. There are tangles, there are amyloid plaques. These are unnecessary things and these are the things which damage the nerves. This comparison between normal brain and brain in Alzheimer's. Brain in Alzheimer's has shrunken. Lot of course completely destroyed, so the size is minimized. 10 warning signs and symptoms of Alzheimer's. Number 1, first and foremost, loss of memory. Patients tends to forget everything in day-to-day life, likes to know the same thing again and again, tries to keep everything written, depends on family members in each matter, forgets specially recent events, does the same thing again and again, counts money repeatedly, washes hands times and again. Number 2, cannot tell place, time, person, cannot tell what's the day today, today's date, current season of the year, where is he now or with whom he is speaking. Even do not try to consult calendar to know the date or the day. Three, while writing or speaking, cannot recollect the correct word. Good writer but cannot express ideas in words or writing. This happens repeatedly, not seldom. 4, unwilling to perform and take part in activities. Always try to avoid persons, like to stay alone. 5, cannot solve small problem. When sent to market to buy 3 to 4 items, cannot decide how to do the same. This happens again and again. 6, cannot perform daily personal works like unbutton or button shirts, combing hair, lace shoes, etc. 7, repeated changes in mood or personality, anxiety, depression, suspicion, bewildered attitude, etc. noted in him anytime, especially when out of home. Number 8, cannot understand heights and distances, normal in health yet cannot go upstairs or downstairs, looks for help, cannot determine how much high or wide the stair is. 9, keeps things in awkward places, cannot find it out. For example, keeps mobile phone in fridge or pen in midcase. 10, cannot determine the significance of event, can give anybody any amount of money without any concern. What happens to Alzheimer's patient in late stage? Generally, an Alzheimer's patient lives 10 to 8 years. After diagnosis, the picture in the late stage depends on matters such as when the disease was diagnosed, what is the constitution of the patient, what other diseases he is suffering from, etc. However, following signs and symptoms are commonly seen. Number 1. Symptoms mentioned above become deeper. Number 2. Sometimes he cries out, flies into anger without reason, moves to and from the room, puts same question time and again, cannot do little things without help of somebody. Patients gets very much infection prone, especially skin rashes appear sporadically. Problem of sleep in swallowing of foods, feels a lot of pain during movement, gets chair bound or bedridden. Stops talking, no communication with others. Various groans, moans, wailings come out of his mouth. Patient generally dies in pneumonia, heart attack, kidney failure or embolism of lungs. Who are generally affected? Number 1, this is an old age disease. After 65 years of age, in every 5 years, possibility of affection is increased twofold. After 80 years of age, in every 6 dementia patient, one is Alzheimer's. 2. 6. Women are affected twice as much as men. 3. Familial inheritance. If ancestors suffered from this disease, the probability of affection of present generation is more. Number 4. Lifestyle. Many say person who used to take alcohol and animal flesh, red meat, more fall prey to this disease. Sedentary lifestyle with addiction to cigars is dangerous too in this context. Five. Following diseases state dispose persons to Alzheimer's: diabetes, stroke, cardiac diseases, high BP, high cholesterol, overweight. How to prevent Alzheimer's? Alzheimer's patient has to suffer a lot towards the end of his life. So also his family members. Many like to avoid the disease altogether. As such, it is stated in details. Ladies having a first relation, blood relation with an old or deceased Alzheimer's patient should take special care. As the disease is incurable, so fighting against it should be taken from an early age. For prevention, we shall take twofold actions. Number 1, we shall avoid or rather shun completely few things which are known to be the predisposing factors of the disease. Number 2, we shall practice something which will act as firewall to the advancement of the disease to a person. You would shun the following things altogether. These would stop entry of toxin in the body. Stop taking alcohol and animal fat, red meat. Shun sedentary habits. Give up bidi, cigarettes, cigars, smokeless cigarettes, pan masala, gutka, tiranga, etc. Shun foods prepared with trans fat. Take sugar, salt, saturated fat less. Avoid foods cooked with burnt oil. This oil rejected from big hotels is purchased by small snacks bar or roadside dhabas. Take care not to take such food continuously for a long period. Following exercises we would specially practice. This would keep internal organs healthy and throw out toxins from body. A. Practice handstand, Sirsasana, Sarvangasana from younger age. This would increase the blood flow to the brain. Any one of the three will do. At least one of these three must be done. He who would continue this would be able to perform high level of physical and mental activities for a long time. Due to excess of blood flow to the brain cells would remain active and fresh. Formation of plaques and tangles won't be there. Please look at the exercise again. The posture facilitates profuse flow of blood in the brain. So the brain tissue will remain active. No formation of tangles, no formation of plaques will be there. At least one must be done of these three. Keep life active mentally, socially, physically. Do this in your area of field. There is no fixed formula for all. Diet must be balanced. Water, veggies, fruits, milk, carbs, eggs, fishes, butter, pulse, nuts, whole grain should be in the food in proper proportion. Please mind, milk is food to the brain. Nerve cell need milk very much. Take water 2 to 2.5 liters per day. Many toxins go out through urine. As per your capacity, you must take active physical exercise daily. It is a must and it has no substitute. Keep 1 or 2 days rest in a week. This will help you provide absolute rest as well as dilute the boredom to enliven you for the next day's exercise. Occasionally, do things which would give you pure joy. Find out what gives you pure joy. This is very much personal to you, but mind that it must not demean your body and mind. In fact, pure joy will decrease your age. You will feel yourself like a child. Let alone Alzheimer's. No disease would be able to down you. There are few symptoms which appear in a person of old age and they look like symptoms of Alzheimer's. Close observation reveals that there is a lot of differences between Alzheimer's and an ordinary old man. Now let us check this. There are 3 columns, left sided characteristic, middle column Alzheimer's, third column ordinary old man. Speech. Alzheimer's. Repeated failure to use correct word, such lapse occur again and again. Ordinary old man. Sometimes take time but finally utter the correct word. Speech. Second point. Lost cue while speaking, bewildered attitude. Occasionally lost cues while talking but returns to normalcy. Sense of place, time, person. Almost lost to the sense. Cannot recall what brings him to a particular place. This sense is never lost. Sometimes forget but can recall. Difficult in vision. Sense of height, distance lost. Cannot decide the height and width of a stair. Ordinary man. Difficulty in vision due to cataract or power of lens. That is, no such sense of height, distance lost is there. Planning, solving, decision. Alzheimer's. Completely fails. No planning, no solving, wrong decision. Ordinary old man shows some uneasiness but ultimately can plan, solve and decide. Instant memory, very weak, cannot find out lost things. Takes time, ordinary old man takes time and finally find out the lost thing. At the beginning, the image shown was that of Mr. Mihir Sen, the famous Indian Bengali humor, who was the first Indian to cross English Channel. I close this session paying sincere homage to his memory. Our present session ends here. You have gone through the whole session. Now please give your comments as to the quality of this presentation. How this could have been much better, what should have been added or what should not have been added. I will be waiting for you so that I can give you my best presentation in the coming days. Thanks for the time and attention.